Thank you, Lee Clovis. Hello, everybody. My name is Brian Dowd, and we're going to do our town hall meeting specific to consumer or participant directed today. I want to start off by thanking everyone for joining us, thanking the folks from TELUS for joining us, and thanking the folks from the Department of Behavioral Health and Developmental Disabilities for joining us, as well as everybody who's on the line today. I really do appreciate your attendance. I want to start off by going over just some technical housekeeping issues. For anybody who has trouble with audio, we will deal with that in the Q&A box if they're unable to hear us. If you do get bumped from the WebEx meeting, just log back in. That's usually a connectivity issue. And with all the rain and storms that happened last night, I've been seeing a lot of presentations and Zoom calls and WebEx calls and Teams calls freezing up today. So just log back in, but always know that these town halls are recorded and they're available on our EVV website. So if you need to go back and listen to today's or Wednesday's presentation, you can always do that. Just access the website and get the presentation as well as the slides. Both the audio and the presentation will be there. If you are going to submit a question, if you could use the Q&A function and submit it to everyone and not just the host, please don't put any PHI or anything that would be able to link you back to your personal situation. Try as much as possible to keep the questions generic. And if you do have an individual personal question you need to ask, I'll show you what email address you can send that to. It's secure and there's not many people who have access to that email box. Okay, so again, this is the public forum that is specific to consumer or participant direction. It is the introductory forum for consumer and participant direction as well. We always start all of our presentations with the mission of the Georgia Department of Community Health, which is to provide Georgians with access to affordable, quality health care through effective planning, purchasing, and oversight. Can't make up my own mission. Presentation points. Today, we're just going to go over some real basics around self-direction. I think it's really stuff you guys already know, so I'm going to be breezing through it, but I'm going to keep it at a very high level. But we did feel it was important to go over a few things based on all the input that I've heard from the participant-directed community over the last several months, and really since we started talking about EVV. We're going to do EVV quick reminders and updates so you know where we are. And next step, we're going to talk specifically about EVV impacts to self-direction. And then we're going to have a Q&A session at the end. Hopefully we'll be able to take as many questions as possible. But for those questions that we don't get to, I will give you a resource for getting those questions answered specifically to you. So we're going to start off with the self-directed overview and reminders. I think everybody knows that self-direction or participant direction is a way to take charge of your own waiver services by deciding you doing the hiring, you figuring out what you need in order to stay in the home and community and be safe and secure. Now, also, if you're not self-directing yourself, if you have to or if you want to have a representative, they need to be able to be capable representative, meaning they can do documentation, they can do the all the different steps that is needed in order to do the hiring and the discharge process and just everything that is accounted for with self-direction. We wanted to kind of break out where self-direction lies, and it lies within all of our waivers. In the new options waiver now, or the comprehensive support waiver, there are a lot of services that we allow a self-direction option on. In the independent care waiver program and the elderly and disabled waiver, which you may know as CCSP and SOURCE, those waivers have a much more limited self-direction option, but there is self-direction for personal support services, which is covered by EVV in both of those waivers. So let's talk about what is a representative. A representative is the employer of record. It can be an individual or a person designated by the individual who is the member, in our case, what we call in Medicaid the member. They have to be, as we talked about, capable of completing duties and responsibilities as outlined in the self-direction policy. They can't be paid. They cannot allowed to be a paid representative. They've got to attend all the different trainings based on what waiver and program they're in, sign a memo of understanding or an MOU, and they also must be involved in the plan of care process and sign the plan of care process, whether we call it an individualized service plan or care communication plan. That plan of care, they need to be involved in the process. For self-direction, you also have to be a waiver participant. So we only do self-direction in the home and community-based waivers. Nowhere else in Medicaid do we allow for self-direction. None of the state plan services have self-direction. It is only in those 4 waivers that I discussed earlier. You have to be able to meet that level of care, follow the policy of procedures, which means you would have to understand the policies and procedures. And you also have to be in communication with your case management, care coordinator, support coordination entity, whoever we designate by waivers. We call them different things in different waivers. But you do have to continue to coordinate with the case management function associated with the waiver. So I wanted to take just a few minutes to talk about some of the common issues that we see associated with self-direction. And I want to do this because I have heard a lot about this since EVV. I've gotten a lot of family members and individuals write me specific questions related to EVV, basically saying, this is how I do this now, and how am I going to be able to continue it in the future? And in multiple cases, and it's more than 20, guys, I have had people ask me questions, which is really what we would consider inappropriate service billing or mismanagement of funds. So I told this story in the Wednesday presentation, and I'm going to tell it again, and it's not, I won't include anybody's names, of course, or really anything that would be able to track you back to an individual person. I'm going to be pretty general, but this is a true situation that I got a couple of months ago. I had a representative, and it was a family member, write me and explain that they bill several times a week for what they were calling flex time. And I said, I'm unfamiliar with flex time. Can you tell me what flex time is? Because I do learn something new dang near every day, even though I've been doing Medicaid for 23 years. And they proceeded to tell me that the member on several days a week goes to a group setting. And in that group setting, the aide would pick them up from the group setting. Oh, nothing wrong with that. I didn't understand how that connected to flex. So I asked a few more questions, and they said, well, on those days, we bill for flex time, an extra hour every single day for our employee, the person, the aide, the employee, so that they could get gas money, and so that the family member, the member in this case, on the way home from the group setting, liked to stop and get a snack. And the aide also got a snack. And in order for the aide to pay for that, the family member had made an arrangement that they could bill an extra hour on that day so that they could go ahead and pay for this snack on the way home. And this individual told me that they had been authorized to do this. They had been told it was okay to do it. They didn't really have a specific person who told them it was okay to do it. And basically was asking how that was going to continue under EVV. And I had to explain it can't. That's simply mismanagement of funds and inappropriate service billing. I've had other people approach me and talk about extra time. I've had other people approach me and talk to me in email and some phone calls about billing based on the schedule and not actually when the person is delivering services. So we only pay for services in Medicaid when they start. So when you are actually starting delivering services as defined by personal support services or community living services, that's when you clock in. That's when the work day starts. When that individual stops delivering the CLS or PSS service, that's when the service ends. There is no travel time. There is no extra time. There is no flex time. There is no schedule time. And I'm being really forward with this, and I need to be, because in auditing, if the federal government, which does audits of all of our Medicaid programs, came in and saw this, they would recoup all of the money that was associated with it. If these instances go to the Medicaid Fraud Control Unit, which is a separate entity outside of DBHDD and DCH, they're not us, they would consider that to be fraud. If you are getting paid for a period of time when services are not being rendered, that is inappropriate. So I want to make sure everybody is hearing us say that, because we have never set out to make the EVV a gotcha system. So I want to make sure that we're all on the same page with what's appropriate billing. Some other common policy violations that we know exist out there is billing during services during hospitalization. Now, we do allow that right now during the public health emergency. If the hospital allows the individual in, we will allow that in certain programs. So you just need to make sure that that is allowable during the public health emergency if that comes up. We also see no staffing, but billing continuing. We see documentation and, no documentation for service periods. Regardless of whether it's 3 months or more, in either of those scenarios, even if it's for 15 minutes, it's inappropriate billing and would be considered fraud. We see people refuse support coordination, and as we've said, that is a component of self-direction, so you really can't refuse support coordination. If you are working with DBHDD and you are involved in state funds services outside of the waiver, you need to make sure that you're doing that according to policy. And finally, unapproved family hires. The state, whether it be DBHDD or the Department of Community Health, we need to be aware if there is a family hire. So in self-direction, if it is an immediate family hire, that is something we need to be made aware of. Okay, let's move on to quick reminders. I get asked a lot and continue to get asked a lot, what services are impacted by EVV? So what we've done is we've created a slide, and this is on our website, that says all the different Medicaid programs and the specific services. For EVV, it is just community living supports and personal care supports, whether they are self-directed or consumer-directed or delivered traditionally, whether they are in the now and comp waivers, or in the CCSP and source, which is the elderly and disabled waiver, or ICWP. Those are the only two services: personal support services, community living supports. And we also have that in our Georgia pediatric program for severely disabled children who have in-home supports. Now, it doesn't matter if that community living support or personal support services is basic or extended. If it is those definitions and any of the codes associated with them, they are required to be captured by EVV. So where are we with EVV? We are on schedule for April 1st, the system being up. We are working with fiscal intermediaries right now to get them tested, get them on board. We are doing every 2-week meetings here ongoing. We're going to have very intensive meetings to get our operations together and make sure that their systems can connect to our systems. So that is starting next week, I believe, if not next week, the week after. And we are doing very intensive work with your fiscal intermediaries. So that is ongoing. Right now, we're doing provider training, a lot of provider training. We have 2 registration webinars for traditional providers next week, March 29th, and I believe it's April 1st is the second I think training is available March 29th. The trainings, the town halls are the 31st and the 1st. I'm sorry. But the registration will be available as of March 29th. Also, the call center will be available as of March 29th. So that's very exciting too. Our EVV call center will be stood up on Monday. April 1st, the system will be ready. We'll have done some initial training with traditional providers, and we'll have an ongoing support. For those of you in fiscal intermediaries and working in consumer or self-direction, you don't need to worry about that April 1st date, because between April 1st and July 1st, as part of our recruitment campaign and system refinement, we're going to be working with your fiscal intermediaries to get them on board so that you can be covered through the fiscal intermediaries to continue to receive services through self-direction and through the EVV system. So I don't want you to get worried about, well, April 1st is next week and we need to register and we need, no. In the self-directed or consumer-directed population, you don't need to be worried about that, because we're going to be taking really April to work with the fiscal intermediaries and make sure we can get everybody on board so that May and June, you can start using the system and make sure there's no hiccups before that July 1st date when EVV becomes mandatory for claims processing. I want to go over the communication resources just briefly. So again, all of our information is available on the EVV website. And you don't have to remember this EVV website. I wouldn't be able to remember it. And I can tell you how I get to it every single time. You would have think after 3 years, I'd have it bookmarked, but I don't. I just go to Google, which is my homepage, and I put in DCH EVV. Or sometimes I put in GA EVV. Either way, our website is the first thing that pops up. If you put in DCH EVV, you can easily get to our website. On that website, you will see all the PowerPoint presentations we've done associated with EVV, all of the recordings for every single town hall, including this town hall and Wednesday's town hall. You'll see tons of flyers and announcement. We are doing member and provider readiness surveys, and they are out there. Tons of frequently asked questions, tons of town hall materials. There's even a spot where you can sign up for any future town halls or trainings. Now, the last thing I want to say is this evv.medicaid@dch.ga.gov is a dedicated email address for all EVV inquiries. If you're like me and you think of questions after presentations, or you just want something written back to you, then you should use that EVV address. I respond to most of them, not all of them, but most of the inquiries I respond to myself. And just so you know, just so nobody gets weirded out by it, I do a lot of the responses on the weekends. So you may get an email from me on Saturday morning or Sunday afternoon or evening, and that may come from the EVV mailbox at that time. I tend to catch up with the EVV mailbox through the week if there's not a lot of business in it on the weekends. Okay, now let's talk about probably what you're most interested in, which is impacts to self-direction. So what is changing? It is federally required that for EVV, the Centers for Medicaid and Medicaid Service said that for EVV, personal support services and community living supports must be captured via an EVV system, an electronic visit verification system. It must be done via a mobile application versus paper timesheets. I understand a lot of people are out there still using paper timesheets. So the default system that we are using for EVV is the mobile application. In instances where your aide doesn't have a phone, or there is another verifiable good reason why they can't use a mobile application, there will be a process for members to apply for an exception through the state of Georgia, through the Department of Community Health, to use either a phone line, a fixed phone line in the individual's house, or we will deploy a fixed device to the individual's house that they can use to clock in and clock out. Now, obviously, these will have some limitations that you won't have with the mobile application, like they have to be done in the member's house, right? You have to clock in and clock out in the member's house. And as the administrator or the representative, the employer of the aides, you will have to do a lot of administrative tasks that you would not have to do if the member was simply clocking in and clocking out. But we will have those options when you do not have a mobile application. A good reason for a mobile application. We'll have a form that's available on the website and that we will be passing out to all the fiscal intermediaries, hopefully next week. We plan on having it out next week. So if there are those instances, the fiscal intermediaries and you guys can start asking for exceptions. So what has not changed? The waiver rules and criterias, where and how you receive services. You can still receive services in the community. That is not a problem. How much the payment structure is not affected by EVV. And your fiscal intermediary doesn't change unless you, of course, choose to change them. So again, we've already talked about this. We are already in active discussions with Acumen, Continuum, and Public Partnership regarding their EVV systems and integrating with us. Another question I have gotten repeatedly is about facial recognition in the third-party systems, fiscal intermediaries. I have verified that facial recognition is not required. It is simply one option for attesting or confirming or saying, yes, the services were delivered. So with all the EVV systems, at the end of the visit, you have to acknowledge that the visit took place as a member. And I hear and have heard from a lot of family members that says, hey, my family member can't acknowledge it. They're incapable of signing. And this has been across all the waivers, and they can't do a login PIN. If you, as their representative, is not there to do a signature for them or provide a PIN to authorize those service visits, essentially acknowledging the service, there is a way in these systems to override that and say, you know, no one is available and capable of doing the affirmation of the visit today or the signature of the visit today. TELUS has that and the fiscal intermediaries have that. Now, like with all things EVV, we would not expect that to be the case every single day, where there's not somebody who is not the representative or the member that could sign and attest to their service. But there is definitely the option for that so that services and billing do not cease. Another big question we get a lot is, are you tracking me? And the simple answer to that is no, we're not tracking you. We do a GPS technology location when you sign in and when you sign out for the day, at the beginning and the end. In between, we do not track you. I have had many people ask us, well, what if I turn off my location in between my visits? We don't care because we're not tracking you. We don't have the data for that. We don't have the staff for it. And quite honestly, that's not our purpose or function. We don't care to do that. All we are doing is doing a location check at sign in and sign out as required by the federal government. Another question we get a lot is DCH providing or paying for equipment? We are not. We are not allowed to do this. This is part of the operations associated with EVV. I already talked about the next one about signing in and signing out. We have a way to get around that. All right, let's talk about upcoming town halls. Again, as I said, provider registration town hall will be 3/31 and 4/1. You don't need to worry about that. You do need to worry about the May, June, July, and August trainings, because what we're going to be doing with those is we're going to be seeing who needs what. And if the participant direction or consumer directed folks need a specific Q&A that is just for them in May, we'll do it. If it's needed in June or July or August, we'll do that as well. So we want to make sure that you are continuing to track the town halls. I have gotten a little bit of feedback that from the consumer directed or participant directed community that has said, I don't know why you're sending me all this information. Many of these things don't apply to me. Well, you're right. A lot of them don't. But I want to make sure you have all the information. I have heard from years, specifically from the consumer directed and participant direction population, that we're not communicating enough and not making enough available. We were going to make sure that as part of this EVV process that that was not the case. That's why everything is available on the website. That's why we do all the emailing and the banner messages and YouTube and Twitter and everything else associated with this. And it's also why I make everything available to everybody in consumer or participant direction. I want you to have the authority and the power to decide what's important for you to listen to and what's not. If you get into a town hall and you're like, this is not for me, sign out. You can always go back and review it at a later time because they're all available on our website. Okay, that's it. I am surprised I got there that quickly. I'm feeling really good about that. 26 minutes. That was a little better than last time. So I'm going to pause here and we can bring up the Q&A. I'm going to see if I can do it myself, but I can't make promises that I can. Think I can? Let me see if I can't expand my Q&A because I'm having trouble. Ooh, I was able to do it. I'm excited by the little things lately. Okay, again, this is that EVV mailbox. If you need a specific email to get a specific question for you. Okay, the first question is about employees signing in and signing out from the same device. So your employees will have a unique sign in and sign out, and that's how we'll know who they are. If you're containing one device for that individual and keeping it in your house or wherever for them to sign in, that should not be a problem. I do want to thank Amy for being here today. Thank you for letting me know that, Amy. That's just a little personal side for everybody. When we register for the TELUS program, I'm trying to, when can we register? Okay, we went through the registration and you can register as of Monday, but we would ask that you wait till the 31st and attend. If you're not participant directed member, you wait till the 31st as a traditional provider, go through that town hall training, and it'll go through all of the registration procedures for you. We are absolutely positively working with Acumen. The next question is, are you working with Acumen? We absolutely positively are working with Acumen, and we have a signed agreement with Acumen already. So I think some of y'all has seen earlier presentations where it had all the different groups that we're working with, and Acumen was not in blue, which is our designation for the fact that we had a signed agreement with them. We do have a signed agreement with them, and we do plan on integrating with them before, well before the July 1st cutover for payment. We're working with them now. You can just put, for those of you who do have questions, you can feel free just to put your questions here in Q&A. Where the town halls are on the training website, you cannot find the Wednesday town hall. I don't know if the Wednesday town hall is up yet. It usually takes about a week. So be a little patient with us. We should have it up there next week. You can use, my understanding, the next question is, can we use an iPad? You can use an iPad, but you cannot use a laptop or a fixed computer for sign in and sign out. As far as the exception for a landline, we have a question, will individual families need to fill out the documentation? Absolutely, yes. If you are wanting not to use a application on a phone, you will need to fill that out for each employee that is not able to download the app. And I want to be clear, we're not going to authorize those for the sake of convenience. There needs to be a verifiable reason why the app cannot be used on the employee's phone. Yes, there are other options other than signing in and signing out, and we have confirmed that Acumen, they do have a PIN availability. I've heard a lot of questions that say, well, but the PIN is the last 4 digits of the member's social security number. We have confirmed with Acumen that it does not have to be the last 4 digits of the member's personal social security number. You can set that to be whatever number you would like. I understand we're again getting the question about, well, what if the member can't do the PIN? Again, there is an exception to that process if the member cannot do a PIN. And on days when you are not available as the family member and the individual cannot sign in on the PIN, the employee, your employee, can simply choose that at the end of the day, at the end of the visit, that there's no family member here. I would assume if that at that point there would be another employee who is picking them up. If you are not available, they were incapable of signing in and signing out, and this aide was leaving, right? But if not, if they were going to, let's say, a group center, then that makes perfect sense. They just choose the override, and we will know through our reporting that on those days that is standard procedure. All clients will be available in the TELUS system, but if you are a traditional provider, this is more of a question for traditional providers. TELUS is getting a feed. The schedules will have to be set up electronically. This is another great question. We get a lot of really, really great questions on our email box. That's why I like doing them. How will human error be managed? Human error will be managed like forgetting to clock in and clock out. And I've said this a bunch of times in presentations that I used to work at a record store, right? Growing up, that's where I worked, at a record store. Record Town, Tape World, Coconuts, and Peaches, for those of you who grew up around here. And they were all the same record company. That I was really, really bad about clocking in and clocking out. Really, really bad about clocking in and clocking out. And I eventually got written up for it because I just would get to work and start working, right? We recognize that that may also be the case for some employees. There's human error, right? So on an administrative portal, there's a way that you as the employer can correct those things. That's not a problem. Now, if it's every day, we're going to have the same instance that I had in the record store where we're going to be like, wait a minute, why is every day this member having to have their records manually updated? If you're currently using the DCI and it's electronic, we anticipate that that system will be able to connect with the TELUS system. So yes, you will continue to use that. The form for the exceptions will be made available online, and they will be provided to all of the fiscal intermediaries for use as well. This one is specific. The next question is about, I'm confused about this town hall versus next week's town hall. This town hall is specific to participant direction or consumer direction. The next week's town hall is specific to registering for traditional providers. So you wouldn't, if you're not registering, which you're not going to be since you're going through a fiscal intermediary, that one is not as important to you. You can still attend it if you want to, or you can listen in and see if for any reason you need it, but that's not the one that's most important for you to be in. So to get the question here is, I'm trying to understand what's the difference in using DCI and Acumen and EVV. So if you are fully integrated with DCI and you're checking in and checking out electronically, that will be your EVV system. But please understand, a lot of people are not doing that. They are using paper timesheets still, and paper timesheets will no longer be allowed. So I'm getting a couple of questions that are kind of addressing that issue. So if you're using DCI, we expect that to be your third-party system, and it will integrate with TELUS. Where can you see this recording? This recording will be available on the website along with all the PowerPoint presentations. They are all on the website. We don't care what phone it is on the app as long as you have a unique sign-in on the phone and that it is the employee who is signing in and signing out for the day according to what is required, both through policy and procedures and EVV. The next question is about case management. We are not prepared for case managers to enroll as of yet. We will have that function up and running by 7/1. So please continue to look at the website for case management companies. We will also be communicating that work through banner messages and associations as well. So as far as the next question is about tell us what you have to do for the landline phone. Well, we'll go over that with you once you request an exception. If there's a valid exception, we have specific trainings and user guides that are available with landlines. So that was something we'll go over with you if you're approved for an exception. The next question is, again, a question about, is this only for CLS? Yes. The specific question is, what about respite? It is only for CLS and PSS. It is for no other services, just CLS and PSS. The next question is, thank you for hosting today. No action is needed. Okay, so yes, again, we're trying to inform you of what's going on at all places. Our plan right now is for you all to use the systems associated with the fiscal intermediaries and have those systems connect to us. And that does include Acumen. We are actively working with Acumen. That is correct. So you are correct. Right now, we are going to have further trainings and presentations for you to really understand how to use the Acumen DCI system. I just want everybody to be aware, though, if you are still using those paper timesheets, we're going to need to convert over to electronic, at least for CLS and PSS. Again, if you are a traditional provider and you're looking for registration, please attend the registration on the 31st and the 1st. I've answered the next question. I've answered that question. I'm just making sure I'm going through. The PIN, so the next question is, how are the client or family member verify services with the PIN? So you verify services during the visit. There's like a drop down of services that are rendered. The individual services are connected to codes that are on your plan of care. If you already are on DCI, you do not need to switch to TELUS. I've gone over like switch changes and clocking in and clocking out when not at home. You would do it the same way. One caregiver would clock out and another caregiver would clock in. If you're saying, the next question is that there's just been problems with the DCI application, we can address any issues with Acumen. Acumen has been very good to work with us and wanting to do each individual question. Yes, if there is, authorized representatives can sign out as well as the member. That is very true. So we just got a question about authorized representatives being able to sign out using the PIN. Yes, that is allowed. Okay, getting a lot of the same questions over and over again. If you have questions about your licensure, you need to send that into the EVV mailbox. This is a participant direction meeting. That one's a little out of scope. So send it into this evv.medicaid@dch email address. So if you are using the device that you're using, if it's a tablet or a cell phone, it will need to have geolocation capacity. If that is done through a fixed landline, then that's tied to an address at home, but it does have to be geolocated. So I got a question here asking, briefly explain TELUS. TELUS is the state's EVV system. That's the system that the state has contracted to do EVV. Again, timesheets for PSS and CLS will not be allowed. They are federally mandated to be collected via an EVV system. PSS is personal support systems. PSSX is included. These were two different questions. And so if you are in the now and comp waiver, PSS is equal to CLS. They are really equatable services. We just call them different things in the waiver. PSSX is extended personal support service. How to train employees. There are multiple video trainings that are available. There are face-to-face webinars that are going on right now. Please go. There's also user guides. So we have multiple operational ways to train the staff who will be using it. You need to go to the website and you need to sign up for the trainings. You need to look at the trainings that are available online. You need to look at the user guides, because we tried to set it up so there's multiple modalities for you to be able to get your training in. There's a question here that says you mentioned family members must be approved. I did not. So if I spoke to that, I didn't mean to speak it. So that's not what I was saying.
Hey, Brian.
Yeah.
It's Amy. The person can email me. I think this is in relation to the Appendix K for the public health emergency and the temporary allowing of family caregiver hire. It's, I think.
Oh, thank you, Amy.
You're welcome. So I think for that specific question in relation to, we're still operating under the Appendix K, where temporary family caregiver hires is allowable. Upon the termination of Appendix K, all of that will stop. And we will have lots of communication coming very soon about Appendix K. Stay tuned.
Thank you. See why it's so important for me to have lifelines? So again, about already, the next question is about, I'm already using DCI. Do I need to continue to come to town hall meetings? I'm going to make everything available to you and you can make that choice. Next question is about CAI. Again, only CLS or PSS, no other services. So if you're using CareLogic, you need to contact CareLogic and ask them if they are going to be integrated with TELUS. The next question is, again, another question about CAI. CAI is not part of the state's EVV system. Yes. So the next question is, if the individual member is not capable of signing, can a family member sign for them or an authorized representative? Absolutely. Do I have a friendly phone number we can call? If you're talking about TELUS, TELUS will have a call center that will be available as of Monday, and that information will be on the website. If you need to speak with me individually, you can send an email to this address and I will call and talk to you. I've done it for literally hundreds of people. We are only tracking the next question is, how will we track all the other services? Right now, we're only tracking CLS and PSS because it is what is required by the federal government. But most states have expanded their EVV system once it is up and running to other services. We don't have any specific plans to do that right now, but I can't tell you that we won't do it in the future. Employee training is available online. We do expect Acumen to also do training. Can my caregivers do the training while on the clock? That's a really dang good question. I'm going to take that one back and we will include it in FAQs. That you win the prize for a question I haven't heard yet, which is so rare lately that I'm really excited by it. So thank you for that question. I'm marking it down and we will respond to it and have it on all of our training as well. That's a good one. Hold on, now I lost my place. I got so excited. I lost my place. No, structured family caregiving is also not CLS or PSS, so it is not covered by EVV. It is a different service. I'm just going through. A lot of these questions have already been answered, so give me just a second. No. So this is a question about, oh, so that's again the Appendix K information. You can write Amy if you have questions specifically about that. If you have questions, write the EVV mailbox if you want to speak to me directly, and I will schedule a time to speak with you. My schedule today is really, really busy. It has been all week. This is my 4th presentation this week. So I am booked solid till 6 o'clock today, started at 7 this morning. So if you write this email, evv.medicaid.dch.ga.gov, and you just simply say, hey, I have a few questions and I need to specifically talk to you. I promise you, I will schedule time with you. It'll probably be this weekend where I give you my availability and we can talk one-on-one. Okay? And with that, believe it or not, we are through all 62 of the questions that you all have. So I'm going to go ahead and once again thank Amy and the folks at DBHDD and TELUS and every single person who was on this presentation. Know that these slides and this message, my voice and Amy's voice and Lee Clowis's voice at the beginning, will all be posted to our EVV website as well, so you can go back and review it. Amy has been very nice to put in her email address in the Q&A box if you need to see it and write it down. You can go ahead and do that now. I'm going to just stop one more minute to make sure there's nobody else who has any questions. And once again, thank you guys for your participation today. Thank you. Everyone have a really good day and a really great weekend.